This is actually my second career. My first career was being a sheriff's deputy here in Athens, Georgia. I got into that because I really enjoyed helping people and thought that would be a great thing to do. And I grew up in this community, so I wanted to help a wider range of people. And so looking at things to do, pharmacy seemed to fit that role. I originally got involved with the Mercy Health Center when I was a student in pharmacy school, and they had just started Mercy Health Center. And this was, oh gosh, this was over 10 years ago. It's probably like close to 20 years ago.
Mercy is a free medical clinic. We serve Athens and the surrounding 5 counties. So all of our patients are uninsured individuals that are below 150% of the federal poverty line.
The traditional role of a pharmacist, or what people think of as a pharmacist, is counting pills, putting a label on the bottle, and handing you a prescription and saying, have a nice day. Pharmacists are the drug experts. They understand the drugs like nobody else does. I think you're going to see pharmacists taking more of an active role in treating patients, and that's great because I think the patient benefits from that.
Brian is just a treasure for our clinic. He cares about our patients, he cares about our staff, everyone that he encounters. He's a fantastic teacher, so he works with our medical students, he works with the pharmacy students, our residents, and he is passionate about teaching all of those people. This program that Brian has developed with other individuals here at Mercy is very unique for the Athens community, so it's really the only place that people can go, particularly if they're uninsured or low income, to get treated. So this is a huge benefit. It's a program that's bringing people into Mercy specifically to get treated for hepatitis C.
Hepatitis C has been, by the public at least, poorly understood for a while now. It can affect anybody of any socioeconomic status. The problem is that people that actually have the insurance or have the money can't afford the treatment. Unfortunately, those that are indigent cannot. Some of the therapies are rather expensive, and without a way to get those medications, these patients are not going to get cured. So the way it typically works at Mercy is that a patient will come in and we screen, because they come in for a normal appointment. If we get a viral load back and if we get the genotype, the next stage is to actually counsel with the patient. I educate them on the disease and see if they have any questions, because a lot of them have talked to other people. They're scared because some of the older therapies were kind of scary.
Brian is very personable. He relates medical and pharmacological information in a way that's super easy to understand, so patients are able to really take control of their own health.
Brian is a wonderful, meek person, and I've been knowing Brian for over like 20 years, so it wasn't no stranger, so I feel real comfortable. So I found out 3 years ago I was a diabetic, and 5 years ago I found out that I had hep C. And I came out and I shared my strength and hope to maybe they can do the same for somebody else.
These patients, after they counsel with me, will move on to the social workers that are part of the team. They'll move on to the counselors, or the mental health counselors, move on to nutrition, and then we have spiritual advisors that they move to. After that point, then we start filling out the paperwork to get the medication through the manufacturers. And they've been generous, and it's been fantastic, because these medications are extremely expensive. For a 12-week course of therapy, you're looking at over $100,000 to treat this patient.
Brian works with us. He's committed to a monthly shift of dispensing meds in our pharmacy, and in addition to that, he comes on a weekly basis and devotes an entire day to our hepatitis C clinic. He's served over 1,500 hours in our clinic working with our patients, and I know that's only the hours that he actually logs. That doesn't count the numerous times that he's meeting with physicians and talking staffing patient cases with some of our treatment team outside of Mercy hours.
As time moves on and we get these new drugs, we're able to run more patients through, 10 to 12 patients at a time. And that's fantastic. And to date, from 2010 to date, last I heard was over 100 patients treated. Our cure rate is around 97, 98%, and that's actually including the older therapies that weren't very effective. I was raised, my father always drummed the golden rule in my head, do unto others as you have them do unto you. I'm nerdy enough, I like to go by the Spider-Man thing, with great power comes great responsibility. And so I think we have that responsibility to the community. I think that we all have a responsibility to the community, especially those of us who have been afforded things to help others out. That's very important to me.